continuing my head-to-toe assessment here. I just finished listening and doing the lung assessment. So now I move on to the cardiovascular assessment here. First, I will just inspect and be looking at the carotid arteries and the apical pulse and looking for any pulsations at all and any abnormalities. And then I'll go ahead and feel the carotid pulses on both sides bilaterally and compare those, but I will not be doing those at the same time so that she doesn't lose oxygenation to her brain and pass out. And then I will feel the apex of the heart and the base of the heart. Then I will go ahead and auscultate her heart sounds, and I will be doing this using the bell of my stethoscope here. And first I will be listening to the aortic sounds, pulmonic, tricuspid, and mitral sounds there. And those are all normal. And if I were listening to murmurs, I would be listening with the diaphragm of my stethoscope. While I'm listening to her heart sounds, I would be doing this in 3 positions, having her sitting up as she is, leaning forward, and then left lateral lying. Next, we move on to the breast and axillary assessment, but I'm not going to do that now, so I'll move on to the abdominal assessment, and you can lay down for me. First, I will be inspecting the abdomen, looking for any abnormalities and lesions at all, and I will be looking for normal peristalsis there and any herniations. Then I will move on to auscultation of the abdomen. I will use the diaphragm of my stethoscope to listen in all 4 quadrants, listening for vowel sounds, starting in the right lower quadrant, right upper quadrant, left upper, and then left lower quadrant, listening to vowel sounds. And then I will move to use the bell of my stethoscope to listen to the renal arteries. First I will listen to the right renal artery, which is to the right and above the umbilicus. And then I will move over to the left renal artery, listening to the left and above the umbilicus. And then just above the umbilicus, I will listen to the abdominal aorta, and I will be listening for any bruits there. Next, I will go and percuss the abdomen, and I will be starting in the right lower quadrant and moving all the way around in all quadrants. And I'll be listening for tympany and dullness, which dullness I would hear over any of the organs, and then tympany I would hear over any fluid or air-filled cavities. And then I will also percuss the liver on the right side and the spleen on the left side. And then I will go on and palpate using 2 fingers in a circular motion. I'll be feeling and palpating here lightly. And then I'll move to deep palpation using 2 hands and feeling there. Figure out all of the quadrants there. And then I will palpate the liver and spleen. So I'll have you take a deep breath and then breathe out, and I will palpate the liver under the right rib cage, and then do it again, and breathe out, and feel for the spleen under the left rib cage on the left side of her. And then I will also feel the abdominal aorta if there's any herniations there at all, and then I will be feeling the inguinal nodes and the femoral arteries here. And while she is still laying down, I will feel her hips here, and then I'll be doing range of motion activities here and go out and in, good, and I will be hearing for any clicks and be doing that bilaterally to hear for those. And also while she's lying down, I will be checking her extremities, her feet and her arms, that they are equal in length bilaterally. So that is good. You can sit up for me. I'll move on now to the lower extremities. I will be inspecting the hair here on the extremities and making sure there's equal distribution here, and also any muscular atrophy. And then I will be feeling the legs here and feeling the temperature of the legs and for any edema. And I will be checked for pitting edema by pressing on the top of the foot for 10 seconds and releasing and seeing if there is any pitting edema that lasts longer than a second. And then I'll be checking the pulses behind the knee. I'll be checking the popliteal pulse. Behind the ankle, I will be checking the posterior tibial pulse, and on the top of the foot, I will feel for the dorsal pedis pulse, and I'll be comparing those bilaterally that they're equal strength. Next, I'll move on to the range of motion of the lower extremities. So I'll have you roll your ankles around for me, and that looks good. And then I'll be doing passive range of motion with the knee here, so I'll have her kick out, and I'll be doing that for her. And then now active, and I'll have her do that herself without me doing it for her. And that's good, so she has good range of motion there. And then I'll be checking the strength and have her push back on me and forward, and then in, and then out. So she has good strength bilaterally there, so that would be a 5 out of a 5. Alright, to continue with the musculoskeletal assessment throughout the whole time, this whole assessment, I will be watching her musculoskeletal and comparing bilaterally her strength, symmetry, and coordination that she has there, and everything is good and intact. Next, I'll complete the neuro assessment by having you touch your nose to my your finger and then my finger here, and then good. So there's good coordination there. And then I will have you touch your fingers to your thumbs, back and forth for me. Good. And then I will have you lift up your leg and glide along your shin there on both sides. And so she has good coordination there. And then I'll have you stand for me and lean forward. And first I will just be looking at the spine here, and then I will be palpating the spine and looking for symmetrical alignment and any scoliosis or kyphosis there, so that looks normal, and you can stand back up. And then I'll have you do a range of motion where you twist from side to side, and then lean side to side, and then lean back and forth. So she has good range of motion with her spine there, so that looks great. And then I will go ahead and check her gait and have you walk back and forth for me, heel to toe, and watch her gait and her balance coordination there looks good, and you can walk back. So that looks good, her gait there. And then I'll be checking the Roberts test. I'll have her stand with her arms at her sides and her eyes closed, and I'll be watching her and guarding her in case she were to fall, but she passes the Roberts test and does not have any dizziness at all. So you can go ahead and sit back down for me, Lindsay. And then I would finish by washing my hands and thanking the patient, and I am finished. Thank you.